In this video, we shall learn about the examination of the newborn. It includes examination at birth, examination at 24 hours of age, examination at the time of discharge from the hospital. We will also be dealing with the examination of the newborn in detail in case the neonate requires admission to the SNCU or NICU. Minimal prerequisites for performing the examination optimally are warm room to ensure baby does not become hypothermic, fresh clean autoclaved baby sheet, thermometer, a weighing scale, a stethoscope. Additional things that are needed are a measuring tape, preferably non-stretchable, a wall clock, good light source, and the newborn should be kept warm throughout the examination. After examination, the information should be communicated to the family and must be documented in the baby case sheet. It is very important to wash hands thoroughly before and after the examination of a newborn. Now, let us learn the examination at birth. The aim of examination at birth is to observe for and assist in a smooth transition to extrauterine life, to screen for malformations, and to make an overall assessment of the baby's condition by examining various body systems. Newborn history includes a review of current pregnancy and taking note of details of labor and delivery, review of medical illness in mother, if any. It also includes making an assessment of the various screening tests performed in mother, along with taking note of any perinatal risk factors for sepsis. It is necessary to determine the gestational age of the infant. If the newborn is not facing any acute problem after birth and is breathing well, it is important to delay the comprehensive assessment till the mother and baby are in skin-to-skin contact, and this is continued uninterrupted for 1 hour. The detailed examination after skin-to-skin contact includes the following. Observe the infant's general appearance, which includes baby's posture and position at rest, baby's spontaneous movements, color and respiratory efforts. Measure the weight and review the other vital signs: temperature, respiratory rate, and heart rate. The normal newborn temperature, when measured in the axilla, varies between 36.5 degrees to 37.5 degrees centigrade. The respiratory rate is counted for 1 full minute and normally is between 40 to 60 breaths per minute. Heart rate varies from 120 to 160 beats per minute in a normal newborn. Now, screen the newborn from head to toe. In the examination of the head, examine the sutures and anterior fontanelle and look for any swelling. This is followed by examination of the back. Look for any swellings, tuft of hair, or any other visible deformity at the back of the neonate. Check the oral cavity for defects like cleft lip, cleft palate, and check the tongue for its size and shape. Observe the face for dysmorphism or for any asymmetry during crying. In the eye, check the conjunctiva for erythema, any exudate or orbital edema, and subconjunctival hemorrhage. Also, check for yellowish discoloration of the sclera. Check for the size, shape, and reactivity of the pupils. A normal newborn's eye transmits red color. The absence of this red reflex might indicate some abnormality and may even be a sign of cataract. Now, examine the ears for their size, position, and appearance. Check the nose, neck, chest, and abdomen for any abnormality or asymmetry. Thereafter, the umbilical cord should be inspected for its appearance, Wharton's jelly, and the number of umbilical vessels. Any time later, erythema surrounding the stump or discharge from umbilicus indicates infection of the umbilicus. Examine the genitalia for ambiguity and look for malformations. Examine the limbs and the extremities for a possible birth defect or trauma during the birthing process. Some fractures may need immobilization. The examination for hip instability must be done as the last part of the examination, and it should be performed when the infant is quiet and relaxed. Now, let us learn the examination of a newborn at 24 hours. The main aim of examination at 24 hours is to assess the neonate for maintenance of temperature, as also for establishment of breastfeeding. A complete comprehensive assessment should be done. Measure the temperature and check if it is between 36.5 to 37.5 degrees centigrade. Watch for any yellowish discoloration of the skin. Watch for any discharge from the eyes or umbilicus or any redness around the umbilicus. Count the respiratory rate, check for any retractions, and note down if there is any deviation from normality. Assess the limbs and back for any abnormal swelling. Inspect the head and palpate the sutures. This will help us to distinguish between caput succedanum and cephal hematoma. One should also ask the mother about the passage of urine and meconium by the baby. Normally, a neonate passes the first meconium within 24 hours of birth and urine within 48 hours of birth. Ask the mother if there are any issues related to the breastfeeding. In case there is any issue related to the breastfeeding, watch the neonate while breastfeeding for appropriate positioning and attachment, and also assess the adequacy of breastfeeding. It is important to check and observe the newborn's reflexes like Moro's reflex, Palmer and plantar reflex, rooting and sucking reflex. Record all the observations of the examination in the infant's file so that it can be compared later with subsequent assessments. If the above assessment is within normal limits, classify the baby as normal and reassure the mother. In all cases, every attempt should be made to keep the mother-baby dyad together. In any case, if the neonate is not well and has any issues that may warrant admission of the neonate in the SNCU or NICU, either immediately after birth or sometimes later, every attempt should be made to keep the mother in the same premises as the baby. Now, let us learn what all we need to examine in a baby that requires admission to the SNCU or NICU. Examination of a newborn baby allows us to assess the baby's condition, look for any emergency signs, and triage the baby. This should be followed by stabilization of the neonate. After stabilization, management should be decided according to the condition of the neonate. Once the baby is stabilized, it is important to have ongoing monitoring of all neonates admitted to the SNCU. All the babies admitted to the SNCU should be nursed in a thermoneutral environment with appropriate developmentally supportive care. The concept of family participatory care should be an utmost priority, and the parents should be made an integral part of the care of the neonates. Every attempt should be made to keep the mother-baby dyad together. During the examination of a newborn, make sure that you have good lighting and the newborn is kept warm throughout the examination. It is also important to note that the overall condition of the neonate should be well communicated to the family members on regular basis. Start your examination without disturbing the baby. Try to look and analyze the vital parameters on the display panel of the pulse oximeter, which is showing the heart rate and the oxygen saturation with a regular plethysmography waveform. Also look at the display panel of the radiant former and note the skin temperature being displayed. Make sure that the skin probe is well attached and is in correct position. Remember to check the temperature with the digital thermometer at least once per shift. Now, assess the breathing of a neonate. Look if the baby is breathing regularly. Count the respiratory rate for complete 1 minute and look for any retractions or grunting. Now, the complete head-to-toe examination of the newborn should be performed, which includes examination of the fontanelle, sutures, and any swelling like caput succedanum and cephalhematoma. Look for any facial dysmorphism. Examine the limbs and extremities for any birth defect. Do not forget to examine the umbilical cord. Look whether the cord is healthy or there is any redness or discharge around the umbilicus. Check the genitals for any ambiguity or malformations. Always remember to examine the back of the neonate for any swelling or abnormality. Don't forget to look for any midline defects such as cleft lip, cleft palate, neural tube defect, or anal atresia. See if the neonate has any yellowish discoloration of the skin. Look for the extent of jaundice and investigate accordingly. After completing the head-to-toe examination, now let us learn how to do systemic examination of a neonate. For examination of the respiratory system, look for the respiratory rate and breathing pattern. See if the neonate has any features suggestive of respiratory distress, like fast breathing, retractions, or grunting, along with the oxygen saturation. Listen to the symmetrical breath sounds with the stethoscope. Now, moving to the cardiovascular system examination, examine the precordial area for any abnormality and listen to the cardiac sound. Note if there is any abnormality in the heart sound or any murmur if present. Pulse oximeter screening is a mandatory part of newborn examination. Pulse oximeter screen is considered pass only if the saturation in both right upper limb and lower limb is more than 95% and the difference of saturation between the right upper limb and the lower limb is 3 or less than 3%. After this, look at the abdomen of the baby for per abdomen examination. Look and assess for any distension of abdomen. In case if you find an infant with the distended abdomen, examine if it is tensed and tender. Rule out any surgical cause if the symptoms are suggestive. Also, look for any organomegaly. In this continuum of examination, we would have observed the overall general activity of the baby, which would provide us the idea about the higher mental status of the baby. Look for the level of alertness and the behavioral state of a neonate. This can be divided as state 1, that is deep sleep, where the baby is having regular breathing with closed eyes and there is no spontaneous activity. State 2, also called as a state of light sleep, in which the neonate has eyes closed with rapid eye movement, with irregular respiration, along with random and smooth movements. State 3, drowsy state. In this state, eyes may be open or closed, infant appears dazed, reacts to stimuli with change in state and has smooth movement. State 4. In this state, the baby is alert with bright look and has minimal motor activity. State 5. In this state, the eyes are open with considerable motor activity. In state 6, you will find the baby crying actively. A normal neonate is consolable during crying, cuddles and clings to the examiner when alert. For a motor system examination of a neonate, look for the posture. A normal term neonates maintain its posture in flexion, while preterm neonates cannot maintain the state of flexion and have his limbs slightly extended. Observe for the quality and symmetry of movement of limbs in a neonate. A normal neonate can move all the limbs randomly and smoothly on its own. Now, look for the tone of a neonate. If the neonate has hypotonia, there will be floppiness of extremities, and in case of truncal hypotonia, the neonate when held in dorsal suspension, there will be a rag doll-like posture. While on the other hand, in case of hypertonia, the tone of limbs and trunk would be increased. It is very difficult to examine all cranial nerves in the neonates, but one must not forget the examination of pupil for size and reaction to light. This can provide us the information about the intactness of second cranial nerve. Observe the face of a neonate for any asymmetry. Look at the baby during a feeding session. A normal suck-swallow-breathe cycle indicates normal 5th, 7th and 9th cranial nerve. At the end of examination, do not forget to examine important reflexes, including Moro's reflex. This reflex can be elicited by holding the baby's head at 45 degrees from the bed and then lowering it down rapidly. Normal component of Moro's reflex include abduction of upper extremities and extension of the arms. This is followed by extension of fingers with adduction and flexion of arms. Palmar reflex. For this reflex, place your index finger across the palm without touching the dorsal surface of the hand and apply gentle pressure. For a normal reflex, all fingers should flex around the examiner's finger with strong grasp. Plantar reflex. This reflex can be examined by pressing your thumb against the balls of toes of infants' feet close to the metatarsal and observe the sustained grasp with plantar flexion of all the toes followed by gradual relaxation. Both palmar and plantar reflex should be checked in both the limbs. Rooting reflex. Stroke the newborn's cheek lightly or bring the baby towards the mother's breast and observe the neonate turning the head to find the expected mother's nipple. Now, let us observe this baby that is lying comfortably in a bassinet. This is a 32 weeks baby with a weight of 1500 grams. This baby was admitted for prematurity and low birth weight. Let us plan the management of this neonate. This baby is hemodynamically stable with normal vital parameters. Questions that come to our mind are: what should we do next? Should we start intravenous fluid or give feeds? If the feed has to be given, then by what mode it should be given and what feed should be given? Let's answer this question one by one. This is a preterm, low birth weight baby. Hence, this baby needs vital monitoring along with blood sugar monitoring in the SNCU. Blood sugar monitoring for such neonates is done at 2, 6, 12, 24, 48 and 72 hours of life. The baby is nursed under the radiant warmer with developmentally supportive care. Now observe this baby. This neonate is wearing a cap, socks and shirt and is covered with a blanket under a radiant warmer. For prevention of heat loss, you can apply coconut oil. Remember to check that the sensor probe is attached at an appropriate place. Always remember to look for any risk factor of sepsis in the mother. This includes a history of prolonged leaking membranes for more than 24 hours, history of prolonged labor, maternal fever of more than 37.8 degrees centigrade, or foul-smelling discharge. For this baby, we could not find any risk factors in the mother, and this is a case of spontaneous preterm labor. So, no antibiotics are administered to a neonate. Assess the baby for feeding cues and decide the mode of feeding according to the gestation age of the baby. Neonates more than 34 weeks can accept breastfeeds well. For those neonates of 31 weeks and above of gestation, start with the paladay feeds and give the trial of breastfeed in between. For the neonates less than 31 weeks, orogastric tube feeding is preferred with the intermittent trial of spoon feeding depending on the acceptability of the neonate. The ultimate goal should be to discharge all neonates on exclusive breastfeeding. For this baby, we decided to start full feeds as per the day's requirement. Since the baby is 32 weeks of gestation, spoon feeds are initiated and the mother is advised to express her milk every 2 hourly. It is important to educate the mother regarding the benefits of breastfeeding, and she should be taught the correct method of manual expression of breast milk. The mother should be allowed to visit her baby in the SNCU any time of the day and should be counseled about the kangaroo mother care and its benefit. You can see that this mother has been involved in the daily activities of the baby, like changing diapers, applying oil, and giving feeds. Family participatory care, including KMC, is a crucial component of the care of low birth weight neonates, and every effort should be made to work towards it. The mother should be trained in understanding the cues of her baby before discharge, and she should be well versed in identifying the danger signs in the neonate. This would not be possible without allowing them inside the SNCU and involving them in the care of their baby.